that can attack at any moment, seemingly out of nowhere. Before you even know what's happening, your head is throbbing from a migraine.
I had no idea that headaches could be so debilitating.
They became much more severe, they lasted longer, and the pain was such that I couldn't get any relief.
Because they can be so severe, a migraine can disrupt a person's normal life for several hours or several days.
These headaches are so severe that I really can't function very well. I can't focus, I can't concentrate. It just seems to take all my attention away from everything else.
I've lost productivity at home and at work and spent countless numbers of hours sitting on my couch.
Migraine affects nearly 30 million Americans and might be genetically inherited. Migraine is a disabling headache that results in producing moderate and at times extreme pain in many individuals afflicted by this disease.
I've had migraine headaches for about 25 years, the last 10 of which have been most problematic on a day-to-day basis.
Most of my life, for example, I had headaches that you would just take a couple of over-the-counter pills for and they would go away, until just 4 years ago when this happened.
Though migraine headaches cannot be cured, they can be controlled, and those who suffer from them can learn how to cope with and manage them.
There are a number of things that migraine sufferers can do to better manage their disease. Keeping a headache diary is a really useful tool. Recording when you get your headaches, where the pain is, how long they last, the frequency. Those are really helpful things for your healthcare provider to know. Also include things like what you ate before you got your headache, if you took medication and did it work for you, were you in a stressful situation, or if you're a woman, is it close to your menstrual cycle. These are things that are really helpful in getting a proper diagnosis and better managing your disease.
The important aspects of treating migraine is, number one, make sure the diagnosis is correct. Make sure the person understands what a migraine is, and make sure that you've addressed these issues medically. Number two, treatment. Treatment issues, you need to merge pharmacologic and non-pharmacologic approaches. Medication is key in the control of the pain, but non-pharmacologic approaches are also important in this chronic disorder.
A recent study by the National Headache Foundation revealed that many of the nation's migraine sufferers still remain undiagnosed. Thus, people are still enduring migraines needlessly because they haven't been prescribed effective treatments or education to help manage them.
Migraine sufferers are undiagnosed often because they think they're suffering from sinus or tension-type headache, and they'll use over-the-counter products to treat that condition, and it's a condition that they may not have. So what we recommend is that you go to your healthcare provider, make an appointment specifically to talk about your headache problem, and be properly diagnosed, and then you can get on the appropriate treatment plan.
Migraine is a very disabling episodic headache. The confusion that occurs with sinus symptoms, migraine can have associated sinus symptoms about 60% of the time, but there will not be an elevation in temperature, and any drainage that occurs in migraine will not be purulent. With tension headache, it's essentially the absence of the migraine symptoms. You're not going to have a disabling headache. There isn't going to be light and sound sensitivity, photophobia, phonophobia, or significant nausea.
Whether or not you take medications for migraine, making lifestyle changes and avoiding triggers can help reduce migraine frequency and symptoms.
There are a number of things that migraine sufferers can use on a daily basis that don't have to do with medication, and that would include things like diet control, lifestyle techniques including getting up and going to bed at the same time every day, even on weekends, exercise, and biofeedback. These are all things that patients have under their control that they can use to help improve their quality of life while living with migraine.
Migraine occurs in two forms, both with and without aura. Aura occurs in three main versions: a visual, a sensory, or motor. These auras are gradual. They begin over about 5 minutes, and they usually do not exceed 60 minutes. Most are about 20-30 minutes. And about 20% of migrainists will experience aura. The nausea component of migraine usually occurs after the aura is over, when the pain has actually begun.
Treating migraines is not a one-size-fits-all condition. There is a broad spectrum of treatment based on the frequency, severity, and disability of migraines.
When you address the medical treatment for migraine, medications come in two forms. Acute, when you get the headache, what do you do to treat the patient? The key issue, patients should have medicine that specifically works to control the pain in 2 to 4 hours. That's relief of all symptoms. That's your ideal goal. The prevention is essentially to take something on a daily basis so the headache never occurs. There are newer forms of prevention that actually do not include medicine every day, but that's in development.
If someone suspects their frequent headaches may be migraine, they should keep a headache diary and make an appointment with their healthcare provider to specifically talk about their headache problem.
Consult with your healthcare provider for more information about headaches and migraine. For more information about treating migraine pain, visit maxalt.com.